I was afraid if I called 911, they wouldn't even get to me in time. Like it was so extreme, I couldn't breathe. A tumor on my left kidney. I think I was temporarily emotionally paralyzed. I didn't have a will, and that I had to write that out for my son. And yeah, I still get emotional about it because it's no one wants to write that when they're actually faced with a really serious situation. You're thinking, gosh, what if something does happen to me and he'll have no memories of me? I really love just being outdoors any chance we get, whether it's on the skating rink or building a toboggan slide in our backyard. Live on a little river, or just in the front garden. I kind of literally built a white picket fence around a garden at my house and attempt to garden when I have time. The first 3 months of postpartum were really rough, but I was finally in that stage where I was loving being a mom. I was getting sleep, and I was on mat leave because in Canada, you can take up to 18 months. I was home alone with my son, who at the time was around 9 months old, and I started getting this extreme pain kind of in my sternum. And it actually almost felt like a heart attack, to the point where it got so bad I was afraid if I called 911, they wouldn't even get to me in time. Like it was so extreme, I couldn't breathe. I live 5 minutes from a hospital that sometimes has an ER open. I took a chance and I drove me and my son there, basically hobbled through the door with him in one arm, and they ran to me, grabbed my baby, and immediately got me in. Um, did an EKG just to make sure it wasn't a heart attack. And thankfully, the ER doctor who was there that day also had a gallbladder attack after she was in postpartum. After she had a child, it can be pretty common after pregnancy. And she recognized the symptoms right away and said, "This is a gallbladder attack." And when they did the ultrasound to confirm the gallbladder attack and find the gallstones, which they did, they also found a tumor on my left kidney. I have a really good family doctor. He was pretty honest with me and said, yeah, most kidney tumors end up being cancerous. The ER doctor said she was referring me for an urgent CT scan. So she kind of went above and beyond. I got the call saying it was cancerous. I was diagnosed with clear cell renal cell carcinoma. It was stage 1 and grade 2. And my oncologist came in and explained, yeah, unfortunately, there was a little bit missed, that just didn't look like tumor. Like they had cut a really good size around it, obviously, and there was still some cancer cells found in one of the margins, but he said with the amount they had to cauterize my kidney, it's highly unlikely that any cancer cells were left. The first option was going to be a laparoscopic partial nephrectomy based off of the imaging they had. They said if once they're in there, they might need to do a full nephrectomy and open surgery. It was kind of an out of body experience because this all happened so fast, thankfully, which here urology is really backed up. Like most people have to wait months to get even cancer surgery. A couple hours later, I got home and it was an unknown number call. He's like, "How does next Friday sound?" And so it was like that quick. I think it was like a week and a half from when my first appointment was with him to when he booked me in for the surgery. So he literally a couple hours before told me it'd be months, and then it ended up being days. I had a lot of people on my team that pushed it forward more, and it's also they don't often see young moms come in with kidney cancer. So I think they're really empathetic to the fact that I had a little baby in their office with me. I think that had an impact. And there was numerous people. I had a nurse advocate basically who advocated and called these offices, taking the time to explain my situation and really push forward for me to have that appointment sooner. It's a program they have in Manitoba for people recently diagnosed with cancer, and those nurses help bridge the gap to make sure no one slips through the cracks. Their job is solely to advocate for you and connect you with resources, whether it be for you or your family, mental health resources, just information, someone you can reach out to with questions in the meantime while you do wait. I found out about the tumor end of November, got the call December 5th about it being cancer likely, and then by January 3rd was my surgery. So it all happened so fast that I think I was temporarily like emotionally paralyzed. The hardest part emotionally was when before surgery I realized I didn't have a will and that I had to write that out for my son. And yeah, I still get emotional about it because it's like no one wants to write that when they're actually faced with like a really serious situation. It's one of those things I wish I had done when life was just fine. Because yeah, like it puts you in the spot where you're thinking, gosh, what if something does happen to me and he'll have no memories of me? So I put together like an album on my computer of a bunch of photos and memories for him. I wrote him a letter, and then just put together a general will as well, make sure I had all my affairs in order. And that was hard to do after such a serious diagnosis. I couldn't lift my baby for 6 weeks. So that was really hard. They hadn't taken out my gallbladder yet because they were just kind of like, who cares about the gallstones? We need to get rid of this cancer. They kind of just hoped that like the gallstones wouldn't cause me trouble. But 3 days before my partial nephrectomy, I started basically projectile vomiting again and having episodes from the gallstones. And unfortunately, because the surgery for my kidney was on my left side and the surgery for the gallstones would be on the right side, they just didn't have the capacity to tackle both at the same time. And at the time, they didn't think they'd maybe need to, like, okay, she's just having an episode. She should be okay. Let's hope she doesn't go through it again during her recovery. But then by end, like, I think it was mid-January, I started having severe gallbladder attacks, which compromised my um, comfort during recovery. So I ended up back in hospital with to have emergency surgery to have my gallbladder removed. About I think it was like 2 weeks after my partial nephrectomy. I couldn't eat or drink fluids at all without getting severely ill. Because of the weight to remove my gallbladder, I had developed cholecystitis, like inflammation around the gallbladder, and the gallstones had traveled outside of it. So I developed jaundice and started turning yellow. I was like a Simpson at one point. And this was even after my gallbladder was removed. So I ended up being in hospital longer for that than I did for my partial nephrectomy because I needed to have an ERCP to remove the gallstones, and then I developed pancreatitis. Thank goodness this gallbladder attack helped catch my cancer. I had to have 2 surgeries pretty back to back there. I wasn't fully pain free until about May. The whole jaundice, pancreatitis, gallstone situation was a lot more painful than the partial nephrectomy. They managed to do it laparoscopically. Um, it was still very sore, and obviously I had to regain muscle mass there and scar tissue, and the pain from the cauterization they had to do on my kidney. I developed a bit of a hematoma from that. When I am going through a crisis, I kind of turn off the emotional side of my brain and just think, I got to think logically. I had moments where that would slip. And in those moments, I thought I was going to have a panic attack. I'd collect myself and say, like, I just need to focus on problem solving here. Like, how can I get this fixed as fast as possible? Who can I delegate to? Just knowing what's in my control and what's not. And knowing that once I have the information, I can problem solve and do the best I can with the cards I've been dealt. And I can't choose those cards. I'm not the dealer of that. But I can choose what I do with them and how I manage it. Like I always joke I'm like the luckiest unlucky person ever because the amount of times I've even just heard the word rare the last couple years, but then something miraculous always happens, whether it be getting in for my surgery on January 3rd, even though I was told it'd be months, things like that. I manage by believing that it's going to work out and not because, um, you know, just relying on miracles, but also because, um, I can find solutions to help push it along the way and make sure if there's miracles going to happen, I can do everything in my power to assist that. It's like one of those be careful what you wish for things because I used to think so badly like, oh, it'd be so nice to just like not care so much what other people think. I want to be the best mom I can be. And in order to be that, I need to make sure I'm always putting him before other people's thoughts and what people think. when you get diagnosed with cancer, it has a funny way of making you really not care what other people think suddenly, and you realizing your life is yours and it can change rapidly overnight. And gosh, like imagine just being your last day and making decisions based off of the thoughts of others, and not even the thoughts of others, but your thoughts of what other people's thoughts are, which aren't always accurate, right? So we always have this narrative in our head that, especially as women, we often make up of what are other going to think if I pursue this or if I do that. And yeah, often it's a narrative we've made up ourselves even. So, and even if it's not, who cares? Such a weight off my shoulders. It was such a good feeling. I thought this would impact my life in such a negative way mentally. And it's kind of, if anything, had the opposite effect. Like I thought I would live my life in worry. I thought I'd be so paranoid. And while there's moments of that, obviously anytime something happens or you get sick, you get worried, or pains, things like that. The cancer has helped my mental health in the long run. Once I did go to therapy for a bit and process a lot of it and address how I felt about it. So that was important. It has released a lot of nonsense off my mind that didn't matter. It's like you hear how rare it is in young people for this to happen, but then you also are hearing how often it's happening now in young people. And just to not delay if you notice some serious consistent changes in your body. You know, not every cancer is going to have signs, but sometimes whatever else is going on in your body might be trying to point you in a direction. It can help save your life if you just listen to your body.
Thanks for watching. If you were moved by this video, we invite you to continue by watching this video here on your screen. Also, please subscribe to the Patient Story right here so you can stay up to date on our videos. Our goal is to help humanize cancer and help you feel less alone.